Hello everyone, welcome back to Wellness Hub 360. Today we're discussing how diabetes impact your eyes, nerves, and skin. Millions of people are affected by diabetes, and most people does not fully understand the impact to their body. The purpose of this video is to educate how diabetes impact overall health and well-being. In the previous video, we discussed how diabetes affect your heart and kidney. The link of the video is provided below in the description. If you have not seen it, it is recommended to watch it for the complete understanding. Knowing the ins and outs of diabetes will help you in making the smart choices. It's about understanding the impact to make smart decisions about your health. Studies in the British Journal of Ophthalmology spill the beans on the link between diabetes and eye troubles, especially a troublemaker called diabetic retinopathy. This bad boy is a major player in the adult blindness game, making it super important to keep those peepers in check with regular eye checkups. Now get this, diabetic retinopathy and its buddies are no joke when it comes to stealing vision. It causes blindness among adults who should be in the prime of their working lives. And here's the kicker. A whopping 80% of folks dealing with either type 1 or type 2 diabetes are expected to tango with some form of diabetic retinopathy. That's not a number to take lightly. So how does this drama unfold? It's all about those persistently high blood sugar levels, creating chaos in the back of your eye by clogging up, swelling, and leaking retinal blood vessels. This leaves your retinal tissues gasping for oxygen. The whole saga starts with non-proliferative retinopathy, showing off with microaneurysms, retinal hemorrhages, and blockages. As things heat up, you move to proliferative retinopathy, where abnormal vessel growth and scar tissue on the retinal surface become the stars of the show. And don't forget macular edema, throwing in fluid and swelling in the macula, messing with your central vision. But wait, there's more trouble in paradise. Diabetes brings a whole gang of other eye issues to the party. Cataracts show up early in diabetics, and there's an increased risk of glaucoma, which is a trickier beast to handle with higher eye pressure. Corneal swells due to sugar accumulation messing with corneal anatomy, potentially causing vision problems. And then the ocular nerve leading to double vision because some cranial nerves decided to take a nap. In a nutshell, diabetes isn't just a one-trick pony. It's a maestro orchestrating a symphony of eye issues. That's why taking care of your eyes is as crucial as monitoring your blood sugar. Regular eye checkups are your superhero cape in this battle against vision impairment. So let's keep those eyes sparkling, folks. All right, let's talk about how diabetes affects your nervous system. Recent scoop from neurology spills the beans on the connection between diabetes and neuropathy, which is basically a fancy term for nerve damage. This nerve damage doesn't come quietly. It brings along symptoms like pain, tingling, and numbness, especially giving your hands and feet a hard time. Catching it early and managing it like a boss is key to putting the brakes on these neurological troubles. Now let's dive into the nitty-gritty. Chronic high blood sugar and diabetes messes with both the central and peripheral nervous systems, giving up to half of diabetes folks some taste of neurological drama. The diabetic polyneuropathy, a common troublemaker causing nerve damage that brings along the whole squad of numbness, tingling, pain, and weakness. It's like a stocking glove distribution party, hitting your hands and feet. But wait, there's more chaos. Autonomic neuropathy joins the scene, messing with the regulation of blood pressure, digestion, urinary systems, and heart rate. This can lead to a bunch of issues like gastroparesis, your stomach taking its sweet time to empty, constipation, wild blood pressure, bladder problems, and the tricky business of not realizing when your blood sugar is too low, hyperglycemia unawareness. Diabetic mononeuropathy takes a different route, causing damage to a single nerve, often in your face, torso, thigh, or leg. This can bring on sudden pain or paralysis. And if you thought we were done, enter diabetic amyotrophy, showing off muscle weakness and wasting in the thigh and hips, all thanks to nerve fiber damage. And guess what? Diabetes isn't content with just nerves. It wants a piece of your brain too. It's linked to cognitive impairment, making the age-related decline speed up and cranking the risk of vascular dementia up 2-3 times. This cognitive roller coaster is tied to things like shrinkage in the hippocampus, the brain's memory hub, and damage to small vessels in the brain. The bottom line, diabetes isn't just a sugar level game. It's a whole body experience, especially for your nervous system. Getting in there early and managing things up front is the superhero move to stop these neurological troubles from taking over. So let's be proactive and show diabetes who's boss. Let's talk about how diabetes isn't just doing a number on your internal game. It's also throwing some challenges at your skin, the body's ultimate multitasker. Recent digs into dermatology, like the ones shared in the Journal of Diabetes Science and Technology, spill the beans on how diabetes can mess with your skin game. This isn't just about looking good. It's about keeping your skin healthy to dodge infections and speed up healing. Now, diabetes has a few tricks up its sleeve when it comes to the skin. Ever heard of diabetic dermopathy? It shows up as these light brown, scaly patches on your shins or feet. People sometimes mistake them for age spots, but don't worry, it's harmless. Then there's digital sclerosis, playing a tightening and thickening game on the skin of your fingers and toes. It's like a sugar party on collagen fibers, limiting your joint mobility. But hold on, there's more drama. Ever had diabetic blisters crash your party? These big, spontaneous blisters pop up on your feet, toes, or back of your hands, take forever to heal, and are like a magnet for infections. Now here's where nerve damage, aka diabetic neuropathy, steps in. It messes with your sensation and blood flow, making your skin more vulnerable to injuries, especially on your feet. That can lead to ulcers that take their sweet time healing and are a welcome mat for infections. And let's not forget about necrobiosis lipoidica diabeticorum. A mouthful, right? It starts as reddish plaques and turns into brown, atrophic lesions with yellow borders, usually hanging out on your shins. It's a microvascular complication and can be a real game changer in the looks department. Last but not least, there's acanthosis nigricans showing up as velvety, hyperpigmented areas that scream insulin resistance. It shows up in skin folds around your neck, armpits, and groin, especially in our buddies dealing with obesity and diabetes. Understanding these skin challenges is key for anyone in the diabetes club. Proactive skincare isn't just about looking good. It's about keeping infections at bay and promoting overall health. So let's show our skin some love on this diabetes journey. It is scary to know all the impacts diabetes can have on the body. Understanding these impacts will encourage to take proactive steps to reverse diabetes. In my upcoming video, we will discuss about how to reverse diabetes, what foods will be beneficial, and the supplements will be helpful in reversing the diabetes. Always remember to follow the advice of your healthcare provider and take your medicine as recommended by your doctor. Thank you for joining us today on Wellness Hub 360. If you found this information helpful, don't forget to like this video and share it with others. And as always, stay healthy.